We had a chance to visit with the President, and I told him square away that a number of the promises that he's made to the people of America are not being fulfilled by this health care bill. That this bill, in my opinion, is bad for patients. It's bad for payers, the people that are going to pay for it, and bad for providers, the nurses and the doctors of this country who take care of patients. Because I think this is fundamentally going to contribute to the debt, make the deficit worse, and at a time with the economy as it is and this unsustainable debt, I think that this is not the way to go. And I think that we do need to basically replace this bill with something else, and it's time to repeal what we have. He disagreed, and he admitted, he said, fundamentally, we disagree. We fundamentally are going to disagree on this. And then he wanted to bet me about the Medicare, the Part D, the drug program, and say that's going to cost more than the whole health care bill is. Well, that's not true at all. So the President kind of has been telling people one thing and likely believing it at a time that the American people understand that this is going to dramatically cut Medicare, it is going to dramatically raise taxes, and the cuts in Medicare aren't going to help people on Medicare. It's to start a whole new government program that is going to provide coverage but not care, because this bill doesn't pay doctors, it doesn't provide for training more doctors, it doesn't deal with lawsuit abuse, and fundamentally it's paying for more IRS agents but not doctors, and the American people would rather have more doctors than IRS agents. Well, to me, it's a propaganda piece paid for by the American taxpayer, and the estimates are between $16 and $20 million taxpayer money spent to send out a piece that says, hey, this health care bill is great, when in fact it's not great. It says this is going to make Medicare stronger. I think it's going to make it weaker. You can't take $550 billion out of Medicare. And we're talking about money to hospitals, to nursing homes, to home health agencies, to hospice for people in the final days and hours of their life, and money away from what they pay doctors and nurses, and say it's making it stronger. And they're taking this money not to make Medicare stronger, but to start a whole new government program. I think that the mailer was misleading. It talked about if your children are under the age of 26 that they can be continued on your health plan. These people are on Medicare. That doesn't cover people under age 26. So I thought it was misleading and just part of the big propaganda going on by the administration to try to convince the American people that the American people are wrong. Well, the American people aren't wrong. The American people know what they're seeing, and that's why 60% of the American people right now are opposed to this health care bill and would like to see it repealed and replaced. Well, I practiced medicine in Wyoming since 1983 as an orthopedic surgeon, taking care of families and listening to them and their needs. Doctors are very concerned, and have been for years, with the continued threats of Medicare cuts, when Medicare really doesn't even pay enough in many instances to cover the cost of seeing the patients. So you have an added burden, regulatory burden, paperwork burden, and now getting paid less for that when there is no relief in sight for people who are concerned about the lawsuit abuse. So their expenses of practicing are going up. The reimbursements are basically flat at best, and it's harder and harder for doctors to keep their doors open at current Medicare rates. And the chief actuary for the government who looked at this said exactly the same thing, that they said under these new rules and regulations and cuts that at least 1 out of 6 hospitals and nursing homes and doctors' offices are going to be operating in the red over the next 10 years. Well, for rural communities, they can't sustain that. You can't keep the doors open, but we have great needs in rural America. There are unintended consequences of this bill, or surprises about this bill, that come out just about every day. As Nancy Pelosi said, you can't find out what's in the bill until you pass it. And the American people are finding out, so that once a week I'm going to the Senate floor as a doctor to give my second opinion. Patients come to doctors for a second opinion, and I give that on something that is new and come out about the bill, because my opinion of the bill is that it's bad for patients, bad for payers, the American taxpayers, and bad for providers, the nurses and doctors taking care of patients. And each week I show that there are additional losers under Obamacare, identifiable victims of Obamacare. And we'll highlight that to the American people to say it's time to repeal or replace this bill that's something that lets people buy insurance across state lines, lets them get the same tax benefits that the big companies get, gives individual incentives to people for people to stay healthy, deals with lawsuit abuse, plus lets small businesses join together in an effort to get down the cost of their insurance. There are a couple things about the Berwick nomination. One is the timing of it. The president, for the whole health care debate, didn't name somebody to be in charge of Medicare, didn't have somebody representing the administration here on the Hill to answer the tough questions. What does it mean when you cut $550 billion out of Medicare? What does it mean to our seniors? They had no one there to come to answer the question. So he waited until the law was signed. And then he introduces somebody who says, hey, I love the National Health Service. You know, we're going to have to ration with eyes wide open. You know, you can go through his speeches and his quotes and his writings, and those are the quotes of somebody that is a big supporter of the national health system in Britain, where they are now doing additional cuts. They're going to cut out, they've read a recent study, over 1 million operations. They're going to impact on, you know, varicose veins, cataracts, hernia surgery, gallstones, people for artificial joints, all in an effort to save money. It's a money system orientation to making decisions, not a health decision. Well, I think this is going to go all the way to the state Supreme Court. I understand the reason why states are saying, don't tell me this, that people in my state have to buy this product. Never in the history of the United States have people been mandated to buy a product. And now they're being mandated to buy health insurance. So I think it could come down to a 5-4 decision in the Supreme Court, but this is going to go all the way, and it's going to test the constitutionality and specifically the 10th Amendment of states' rights to say no.